Hello everyone, this is Dr. Shushma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are doing the second part of the fibroid series, which is nothing but infertility or pregnancy problems in fibroids. So if you are someone who is wanting to get pregnant or wanting to have a conception, or if you are someone who is unmarried and you're recently going to get married and you're thinking about babies, then this video is for you. There are certain conditions where there is abortion due to fibroids, where there is conception problem due to fibroids, and there is also another condition where even though we have fibroids also, there is conception, there is implantation, and there is also normal vaginal delivery of the baby. So what are these conditions and how these fibroids will affect your pregnancy or the fertility issues we will be dealing in this video. Why are we dealing or why are we doing this video as such? See, we have a lot number of patients who are coming to us, especially unmarried people and also people who are recently married who are looking for conception or having pregnancy problems. So in order to answer their questions and also in order to educate people on the fertility issues regarding fibroids, we are doing this video. So let's dive into the topic to know more about it. What are fibroids? Fibroids are nothing but they are non-cancerous growths. Okay, so they are non-cancerous. By meaning non-cancerous, I do not mean that there is no case where there has not been registered that a fibroid has converted into cancerous condition. There are cases, but there are a very rare number of cases where the fibroid can turn into a cancerous one, but there are certain conditions you need for that. So today we are only going to discuss about the fertility issues and fibroids. Remember that turning it into a cancer is a very rare condition. So it is non-cancerous in nature, consisting of muscle and fibrous tissue. It can range in size of a grain of rice, that it can be as small as a grain of rice or it can become as big as a melon also. So all of this constitute the description of fibroid. Next, what are the signs and symptoms of fibroids? As I told you, here in this topic, we are going to discuss about the fertility issues. If you're someone who is unmarried or married, and if you're having some hormonal disruption also, we have discussed that in the first chapter of fibroids. The link will be given in the description box. You can just check it. Or if you're someone who is looking for a detailed explanation on all the types of causes, all the types of investigations, and all the types of symptoms, we have discussed that as well, and that link will also be provided in the description box. So now let's check out the infertility issues or the symptoms that are there if you're suffering from fibroids. So what are the signs and symptoms? The infertility related symptoms are, first one, the inability to conceive. For example, if you're having a fibroid near the fallopian tube, then there will be a problem for the sperm. It will travel until the uterus, but from the uterus to the fallopian tube, there will be a problem because there is fibroid, there is physical obstruction as it. And also, there will be recurrent miscarriages. These are the common signs and symptoms of someone who is planning for pregnancy or who is, pregnant right now suffering with fibroids. They have the symptoms which is recurrent miscarriages. That is, they have a miscarriage or an abortion, especially in the second month and the third month and the fourth month. These 3 months are very crucial. If you're someone who is suffering from fibroids, these are the common signs and symptoms. Now let's get into the common signs and symptoms apart from this infertility symptoms. So these are the signs and symptoms which are common in everyone. That is menstrual changes. See, if you're someone who doesn't even know if you're having fibroids or not, to evaluate it, just listen to all of the signs and symptoms. You will be knowing if you have fibroid or not. And also, if you're trying for pregnancy and if you're not able to conceive it, and if you are trying for pregnancy, you are conceiving but you're not able to withhold the baby, along with those symptoms, if you're having these symptoms, then it can be because of fibroid. The first symptom is menstrual changes. Especially in fibroids, you will be having prolonged bleeding. That is, usually the bleeding is for 3 days for some people, 5 or 6 or 7 or 8, but not more than that. If you're suffering from menstrual changes, that is change from your original menstrual period, where it is prolonged, or even if it is for 5 days, the flow is too much, the clots are there are larger or smaller clots are appearing, and there is severe pain associated with it, especially pain in the hypogastric region, especially if it is fibroid, it is bearing down sensation, that is someone is pulling through your hypogastric region, or someone is pulling from your vagina. You will have that feeling. If you are having all of these symptoms, it can be because of fibroid. And apart from that, you will be having pressure symptoms. What are pressure symptoms? If the fibroid is large enough, it can fall or cause pressure on the rectum, leading into painful defecation. And also, if it is falling anteriorly, it can fall on the urinary bladder, where you will be experiencing pain during micturition or pain during urination. And then constipation problem we have already discussed. Anemia is one of the most neglected thing in this fibroid. See, if you're someone who is experiencing prolonged period, even if you're in a perimenopausal stage also, you should not neglect the prolonged bleeding, because a lot of bleeding will cause depletion in the iron content, it will cause depletion in the PCV, which is packed cell volume, it will cause depletion in the HB content and the ferritin and the folic acid levels, which will lead into anemia. And if it is severe, you have to have a blood transfusion. Many people encounter this, they do not even worry, they just feel like they're getting pale, but they just feel because it's of nutritional deficiency, they do not do anything to gain that iron levels back. And also, even if they're having prolonged periods, some people do not even do not even consider those prolonged period. Even if they're getting pale, they feel like they're becoming fairer and waxier, but still they do not go to a doctor or do not get a lab test done. Please do not take these symptoms so lightly, because they are very important for your overall health. Anemia is one of the bad symptoms or the by symptoms of this fibroids. Along with that, we have already discussed the reproductive and the obstetrical problems, which is problem in being conceiving or problem in getting conceived or problem in holding the baby, that is recurrent miscarriages or abortions as such. These are the common signs and symptoms of fibroids. Let's look into the matter more to know more about it. Coming to the investigations part, if you're someone who is suffering from fibroids, the common investigation that you do is an ultrasonography. But before you do that, there is something called as pelvic examination, which is very, very important. If you're someone who is suffering from the common symptom of fibroids, that is prolonged bleeding, anemia, hair fall, waxy appearance, and also if you're having any problem in being conceived, or if you're having any problem with recurrent miscarriages, you have to have a doctor consultation. And during doctor consultation, they can do two types of things. One is palpation, that is pressing onto the hypogastric region to see if the fibroid is large enough and they can feel it. And also there is a second kind of examination called as the bimanual examination. If you see the pictures right here, this is called the bimanual examination. Okay, and it is needed only, it will be performed, otherwise palpation, that is pressing the hypogastric region, is enough. The secondary thing after bimanual examination, if they feel that you have fibroids, then they will be asking you for an ultrasonography or ultrasound abdomen and pelvis, where through the sound waves you will be able to view the inside of the uterus. It is a common investigation if you're suffering from any female reproductive problems. It can be PCOD, ovarian cyst, endometriosis, adenomyosis, or any other female reproductive disorders as such. So to view it, we will be using USG. And if the USG is not clear about the borders, or if there is any other condition along with the fibroids, we will be asking you for an MRI so as to know about the borders in clear. And if that is also not clear, we will be doing a hysteroscopy. As you can see here, this is hysteroscopy, where the instrument is inserted into the uterus to see or have a better look at the uterus. And if you want to view even the fallopian tubes, then you can do a saline infusion, which is saline hysteroscopy, where there is saline injected into your uterus and you can see the fallopian tubes much clearer. That is also another investigation. And apart from that, if you want to remove the fibroids and also view them in a better manner, you can do a laparoscopy. So these are the certain investigations which are regarding your female reproductive organ issue, that is fibroids. Along with that, there are other investigations that you need to do. Let's look into it. Apart from this, there are other investigations that you need to do. Those are nothing but, see, if you're experiencing this pallor, that is waxy appearance of the skin, paleness, you've recently become a little bit 2 tones fairer than your original color, and also you just seem weak every day, lethargic every day, then the doctor will advise you for a CBC, which is complete blood count, where we will be knowing if there is any sort of inflammation, that is looking at your WBC's level, and also if there is any sort of HB count decrease, that is your hemoglobin level, and also PCV, that is packed cell volume decrease. In all of this, we will be asking you for a CBC, and looking at this, we will prescribe the needed medicines. Apart from that, if you're suffering from lethargy, if you're having a recent weight gain, if you're having edema, that is waterlogging conditions, the doctor might ask you to do a thyroid profile, which consists of thyroid stimulating hormone, which is TSH, T3 and T4. Many people who are suffering from fibroid will have mostly will be experiencing hypothyroidism, where the TSH level is very low and the T3 and T4 are elevated. Apart from this, based on your symptomatology, the doctor will ask you to do certain tests needed. Okay, so these are the investigations that you need to do if you are suffering from fibroid. Now let us look into the structure and function of the female reproductive organ as such. So by knowing the structure and function of this female reproductive organ, we will be knowing where the problem is occurring, how the problem is occurring, and why it is occurring, and what is the prognosis of the problem. So let's look into it. This is the female reproductive organ. As you can see, this is it. So here these are the ovaries which produce ovum, and this, from this, the ovum is released, and this it is collected by the fallopian tube. As you can see here, there are two tube-like projections. These are called as fallopian tubes. Okay, and the ovary will have an ovum release, and the ovum or the egg will come and travel here, and it will stay here. Okay, and after an intercourse, the sperm will enter and it has to go here, and when it meets the ovum, there is fertilization and zygote formation. This is a normal phenomenon, and the female body is preparing herself for pregnancy every month. Usually on the 14th day the ovum will be released, and also apart from that, if there is no intercourse, or if there is no fertilization, the ovum, which is supposed to become zygote after in contact with the sperm, will not become a zygote. It will travel down, and along with it the endometrial tissue, which is preparing in thickness, which is becoming thick so as to hold the baby, will also come down. That is nothing but menstruation. Okay, so this is the normal thing happening in the uterus. Apart from that, you have to understand that uterus has three linings, which is the outer lining, the middle lining, and the inner lining. The inner lining is called the endometrium, the middle lining is called the myometrium, the outer lining is called the perimetrium. Okay, and depending upon the layers of the uterus, the fibroids are located. And also uterus is very susceptible to the female hormones, which is estrogen and progesterone. The endometrial thickness, so as to hold the baby, that thickness, whatever is it's growing in size, is because of the female hormone. So if there is any fluctuation in the female hormones, it can lead into fibroids or any other female reproductive organs. If you're someone who is suffering from female reproductive organ diseases and you want to know about hormones in detail, we have already done a video on that, which is called as Hormones and Fibroids. We will be giving you the description in the link below this video. You can check it out also. So here you have known the structure, and here you have known the function of the uterus as well, that is to carry a baby. Whenever there is no baby, there will be menstruation. Now let us get into the causes and risk factors. See, the causes are not the causes for fibroids. Fibroid causes are different, but here we are talking about the causes for infertility, or causes for your recent or recurrent miscarriages. So what are the causes? First is physical obstruction. The main reason why you are not able to carry a baby, or why you are having recent or recurrent miscarriages, is that there is physical obstruction by these fibroids. Second thing is the distortion of the uterine cavity. If the fibroid is going inside the uterus, there is the shape difference in the uterus, which is causing this pregnancy related problems. Apart from that, we have cervical changes if there is a fibroid near the cervix, and also this cervical fibroid can cause differences in there are normal bacteria or flora in the vagina. Okay, these are very common, like we have the bacteria in the gut as well. Okay, under certain pH levels and under certain hormonal levels, they are good for us, or they are maintained like that. But if there is any disruption in the hormonal level, or if you are having a fibroid, this gets disrupted, new bacteria, different diseases arise, and the good bacteria become bad, where there is yeast infection, where there is bacterial infection. All of this are occurring because of fibroid. And impaired implantation. If you are having fibroids, there will be problem in implantation. That is, when the zygote is formed in the fallopian tube, it will come down and attach to the uterine cavity, right? When there is a fibroid, this implantation, this attachment also will not happen. So these are some of the causes. And let us look in deeper about the other causes as well. What are the other factors? That is nothing but increased uterine contractility. See, whenever you are experiencing menstruation, to let go of the uterine contents, the uterus will contract to let it out. Like the menstruation, the endometrial layer is letting out, the ovum is being thrown out. But if you are having a baby, the uterus should not contract. But if you're having a fibroid along with the baby, because of the fibroid, the uterus will start contracting, leading to miscarriages or abortions as such. Okay. And then hormonal and molecular changes. If you're having fibroids, you might have experienced hormonal changes, and hormonal changes in turn cause fibroid. So this is a cycle. If you're having these, then it will be a problem for your pregnancy. Apart from that, inflammation in autophagy and microbiome changes. If you're having fibroid, you will be having changes in the vaginal flora, and also not only that, you will be having changes in the body where there is inflammation. That is, what is inflammation? Your body is reacting too much to a normal thing, and it has started behaving like you have some sort of infection, where there is heat generated, where you're holding on a lot of water, you become fat even though you're not eating a lot. All of these are the causes of inflammation. Any disease which has itis in it is inflammation. Okay, these are some of the causes for recurrent miscarriages, and you're not able to conceive because of the fibroids. Here we will be discussing why you're having these abortions or why you're not able to conceive. First, we will be discussing about it one detail. First one is physical distortion and obstruction. See, for example, this is the uterine cavity, right? And these are the fallopian tubes. If you are having a fibroid near the fallopian tube, okay, so it's obstructing the fallopian tube, right? So we have an ovum here which is waiting for the sperm. We have a sperm here which is waiting to meet the ovum. It is coming up, but it is not able to meet the ovum. So you will be having conception problems, especially if there is a fibroid near the fallopian tube. Apart from this, if you're someone who is experiencing fibroid near the uterine cavity, so this is the fibroid and it is growing slowly. What will happen? This is the normal uterine cavity, right? So what happens is that when the fibroid starts growing, even if the baby has come here and it has been implanted, when the baby starts growing, this fibroid also will be growing and it will not be giving space to this growing fetus. That is where you will have this abortion. So physical distortion and obstruction are the major things why the pregnancy is very hard in fibroids. Apart from that, endometrial receptivity. What do you mean by endometrial receptivity? You have to remember that an endometrial layer should be in a certain way for the baby or the fetus to come and attach to it. Okay, so whenever you're having fibroids, this receptivity or this nature where it is trying to hold on to the baby or the fetus is gone. Okay, it's just like as if you have glue, something will come and attach to it, and suddenly the glue is started to behave differently. It has started to behave like a gel. There is no attachment, right? I'm just taking it as an example. It is not what happens in the endometrium, but the endometrial receptivity to take and attach that thing will go off, or it will behave in a different manner, so that there is implantation problem, or it can be implanted very low, wherein it can lead into an abortion. So this is also a certain thing that you will be facing if you are experiencing fibroids. And the other one is inflammation and autophagy. Remember that the fibroid has another character where it will also take a lot of blood supply. Okay, so it craves for blood supply, even though if the baby is growing starting in a normal manner, because of its increased nature to take the blood supply, you will have deficient blood supply to the fetus, and also deficient nutrition where it can lead to into a miscarriage. And this fibroid will release certain hormones. It can prepare its own estrogen. High estrogen level will cause certain reaction in the body. It can lead into inflammation, where there is different chemical mediators being released into your body, which can lead into problem with the pregnancy. And also we have this vagina uterine microbe, which is I've already discussed in the causes and risk factors. There are common bacteria in the gut. In the same manner, there are common bacteria in the vagina also. Whenever the vaginal pH is normal, or it is maintained properly, and the hormonal levels are maintained normally, the vaginal microbiome is also maintained in a proper manner. Whenever there is alteration in these hormones or alteration in the uterine cavity as such, because of the fibroid, which can create a hormonal disturbance and also uterine disturbance, there will be changes in the vaginal microbiome, which can lead into infections. Okay, so it can lead into yeast infection, prolonged yeast infection. It can lead into bacterial infection. It can lead into recurrent UTIs. All of this can happen. Because why it can lead into UTI? Because that is a different system and this is a different system. Remember that women have very short urethra. So there will be problem if there is UTI infection, you can get something like a vaginal infection. If you have vaginal infection, you can get an UTI in certain section of people. Okay, it depends upon the inert health as well. And also other factors like uterine contractility. What do you mean by uterine contractility? To expel certain things, uterine needs to contract, or the uterus needs to contract. Whenever you are having a baby, if the uterine contracts, you will be experiencing abortion. All of these changes are happening in the uterus because of the fibroid. If I tell you that you will be having all of these problems with fibroids, it is only 50% of what I'm explaining. The other 50% people or the other 40% people will not experience any sort of changes in their pregnancy, or will not experience any sort of symptoms also. So what kind of people will not be experiencing these symptoms? On what kind of people will have a healthy conception, or will conceive easily, and also will get a pregnancy easily, even though they are suffering from fibroids? Let's look into the topic more. Now let us get into the types of fibroids to know more on how it will impact the pregnancy process. As you can see here, this is the female reproductive system, and these are the fibroids. Let us discuss in detail about each fibroid and its impact on pregnancy. So we have already known that the uterus consists of three layers, right? The endometrium, the myometrium, and the perimetrium. Okay, so as you can see here, this type of fibroid is known as the serosal fibroid or the subserosal fibroid. So this fibroid usually grows outside the uterine cavity or the outer lining of the uterus. Okay, usually people who have their pregnancy, they get conceived, they have good pregnancy, they have good delivery. Even if they're having fibroids, usually they conceive in this kind of fibroids, even if they're having it. Okay, so this kind of fibroid will not interfere with the space, because uterine cavity, as you can see, is normal, and also it will not interfere with other processes like conception, implantation, or the growth of the baby. Okay, just we have to make sure that this subserosal fibroid will not grow in larger size, because if it grows a little larger, it can develop a stalk. Okay, it can develop a small stalk like we have in plants, and it can fall, or it can give pressure symptoms on the rectum, which can lead into painful defecation, or it can anteriorly fall on the urinary bladder, which can cause painful micturition, which is also called as painful urination. Okay, so if you're having someone experiencing subserosal fibroids, nothing much to worry in the pregnancy. Just you have to make sure that the fibroid size is not large. Okay, it is very small, and also it is not growing abnormally, and that your hormonal levels are normal. Okay, if you're maintaining this, you can have a good pregnancy. But if you're someone who is suffering from intramural fibroids, which is fibroids which grow in the mid layer as of the uterus, okay, so if these are very small in nature, or even if they are multiple and very very small, like a grain of rice, or a little smaller, that is 1 centimeter, it might not affect the uterine cavity. But if they are growing larger, and if they are more, what will happen? This uterus midsection will bulge, and also the uterus cavity will become small, so there will be abortion. But this kind of fibroids can cause pressure symptoms, like it can close this fallopian tube if it is inside, it can close the uterus cavity if it is inside. So this can cause a little bit of problem. If you're someone who is experiencing intramural fibroids and they're less than 1 centimeter, nothing much to worry. Maintain a good hormonal balance and eat well, so that you will not have a lot of problem in the pregnancy. And the third kind of it is called as a submucosal. This is the main villain, because they are growing inside the uterine cavity, and even if they are small, it can cause a little bit of problem, and if they are large, obviously there will be a problem. So the submucosal fibroids will obstruct the uterine cavity. If they're growing near the fallopian tube, it can obstruct the conception as well, that is the meeting of the sperm and the ovum as well, and it can cause a lot of pain also. So if you're someone who's experiencing submucosal or intramural fibroids, they're very small, very very small, less than 1 centimeter, the intramural, nothing much to worry. Maintain it properly. If they are submucosal, then you have to consult the doctor on a daily basis, so that you will have a proper pregnancy. But if you're someone who is experiencing subserosal fibroid, make sure it does not grow in size, and also make sure that your hormone levels are good, so that you will not develop a lot of other fibroids also. So these other types of fibroids. The other type of fibroid is called a cervical fibroid. Usually it is stocked somewhere here and it is coming here. The fibroid has a stalk inside the uterine cavity. Okay, it can cause a lot of pain, especially during intercourse, and also it can alter the vaginal microbiome. So if you're someone who's experiencing fibroid in the cervical region, it is better that you first get rid of the fibroid and then go for or plan for pregnancy, because it will cause a lot of problem during delivery, and also it will cause a lot of problem even during pregnancy also. Next, coming to the conventional treatment part, which is the allopathic form of treatment, or the Western form of treatment, as we say so. If you're someone who's experiencing differences in the menstrual cycle, or if you're someone who's experiencing conception problems or pregnancy related problems because of this fibroid, if you visit a gynecologist, they will be usually suggesting you for oral contraceptives, or for POP pills, or IUDs, or GnRH antagonists. Remember, here we are not talking about people who are married or have had their children, or people who are unmarried. Here we are talking about a specific section who wants to get pregnant. So if you're someone who wants to get pregnant, or planning for pregnancy, oral contraceptives, they have contraception in their own name, you can't do that, right? Second thing is, you can't use an IUD, because obviously that is also for contraception and also it is not useful. Third thing is GnRH antagonist or agonist as such. So what do? They cause a menopause-like symptom in the body, where they deplenish the estrogen and progesterone level. So you will be experiencing menopausal-like symptoms. Remember, these three things have something in common. They're useful for heavy bleeding, to control the heavy bleeding, and they're useful so as to shrink the fibroid. But remember, they have certain progesterone in them, which can also trigger the growth of a fibroid instead of shrinking the fibroid. So the pathway is to shrink the fibroid, but it can also sometimes trigger its growth. So you do not actually have a cure for fibroid in the conventional form of treatment. And if you're someone who's planning for pregnancy, you're not only looking for shrinking of the fibroid, you're looking for pregnancy options as well. So you need a medicine which will shrink the fibroid without giving you side effects, and also without giving you any problem during pregnancy, and also something that will not mess up with the hormones. Okay, and then they will be advising you for NSAIDs, which are non-steroidal anti-inflammatory drugs, which are usually prescribed for pain. They do not do anything to shrink the fibroid or to decrease your menstrual symptoms, but they will be only dealing with pain. If you're using NSAIDs for a longer period of time, you will be experiencing gastric symptoms, which is acute gastritis, and also if you are experiencing acute gastritis, or it can be converted into chronic if on a longer run, and also it can cause nutritional deficiencies. Apart from that, if you're someone who's experiencing a lot of pain and having a big fibroid, they would advise you for myomectomy, which is taking out the fibroid as such, preserving the uterus. That is what you should be looking for if you want to have a pregnancy. But remember, after myomectomy, you can have a recurrence or a re-attack of the fibroid. So this is not the cure, it's just a symptom removal. But if you're planning for pregnancy, hysterectomy is not even in the option, because they will be removing the uterus as such. So these are some of the options in conventional form of treatment, where there are some backdrops of it, where they are not able to cure the case, where there is no proper cure agenda, where there is no proper health improvement, and also there can be chances of recurrence. But you need a medicine which will cover all of this, and that is nothing but homeopathy. Coming to the homeopathic form of treatment, here the medicines are utterly safe to use. First thing, there is no side effects for the given medication. That is the other thing. And also the recurrence in homeopathy compared to allopathic form of treatment, or compared to the conventional form of treatment, is very low. So if you're someone who is taking homeopathic medications for your present condition of fibroids, the recurrence rate of it is very, very low compared to the conventional form of treatment. And here we will be offering you with fibroid shrinkage, where the fibroids will start to shrink, the menses will start to get better, your anemia will start to get better, where you are having good blood, and also apart from this, you will have overall improvement and less recurrences. All of these are happening without any side effects, and it is utterly safe to use. So if you're someone who's experiencing fibroids, do try homeopathic form of treatment for your fibroids or for your hormonal imbalance as well, because it balances your hormones also. By balancing the hormone, and if the fibroid doesn't grow, it will start to shrink. The medicine given will start to shrink it, and the reoccurrence also will not occur. But if you're just concentrating on shrinking the fibroid, the hormonal imbalance will be there. Again, it can cause fibroids. If you're someone who's experiencing hormonal imbalances, we have already done a video on it. You can come and check it in the description box. The link will be given. So holistically, it will cure your case. It will relieve the symptoms, and further recurrences can be prevented in homeopathic form of treatment. Next, coming to the precautionary part, remember, no matter what sort of treatment you're taking, precautions are very, very important to prevent it on a first thing. Second thing, to reduce the size of it. The first and foremost precaution that you need to do is having a good healthy meal, because dietary changes are very, very important for your hormonal well-being and also for the growth of the fibroid. As you can see here in the picture, we have divided the plate into 4 parts, right? So the first part will constitute your greens, your fiber, your micro elements, okay, and the vegetables. The second part will have two, 1/4, that is 2/4 parts, wherein we will have a little bit of serving of good fats. By good fats, I mean nuts and seeds like almonds, cashew, walnut. You can have macadamia nuts, you can have hazelnuts, you can have pumpkin seeds, watermelon seeds, sunflower seeds, sesame seeds. All of this constitute flax seeds especially, and all of this will constitute under good fats. Apart from fat, you should have 2 servings of protein, which it will include fish. It can include vegan form of diet like dal, especially if you're staying in India or Asia. And then it can also include paneer, tofu, rajma, or it can include chole, beans as such. All of these will come under the protein part. Remember, if you are experiencing any sort of female reproductive issues, do not take red meat, which includes mutton, lamb, beef, and pork, and do not take soy products as they increase estrogen dominance in the body. And in the last part, you will be having the carbohydrate part. The carbohydrate can be rice, it can be your rotis, or it can be any sort of carbohydrate that you consume along with your original, fats and your protein. So make your plate into 4 portions every time you eat, and eat it in this manner as I've told you, so that you will have a reduction in the fibroid size and your hormones also will be good. Apart from that, what you need to do, you have to maintain a stress-free life, because stress triggers the hormonal imbalance, which in turn triggers the fibroid cause. So in order to maintain a stress-free life, even if you're experiencing stress, try to have or do stretching, do yoga, do meditation and pranayamam, and eat good food. Apart from that, you need to have a proper sleep cycle. Especially women of reproductive age need to have at least 9 hours of good sleep for your hormones to work well. And then if you're someone who is experiencing female reproductive organ diseases, and then people advise you, just random people advise you to go for a workout, and then you just go, you run on a treadmill, and then you do certain workouts where there will be severe pain suddenly. See, if you want to work out, have a doctor consultation. Based on the location of your fibroid, the workout should be designed. Do not do workout if some random person suggests you. That is not advisable. So these are some of the precautions that you need to follow if you are experiencing fibroids. What happens if you neglect fibroids? First thing, pregnancy will be a problem. Second thing, the number of fibroids can increase. Third thing, fibroids can associate or cause other diseases because of the hormonal disruption or because of estrogen dominance. They can lead into endometriosis, adenomyosis, they can lead into PCOS, or they can even lead into cysts. So if you're neglecting this, overall health, because some fibroids will have the tendency to produce their own estrogen, which can cause estrogen dominance in the body, leading to overall body depletion or health depletion. So do not take lightly if you're experiencing menstrual irregularities. If you're someone who is experiencing fibroids and watching a video, if you want to have a good cure for your symptoms as such, you should be choosing Fidicus Homeopathy. In Fidicus Homeopathy, we have 2 kinds of consultation options. One is the online consultation if you're staying far away from the nearest branch of Fidicus, and in-person consultation if you're staying near the nearest branch of Fidicus. In online consultation, we have 2 options. One is the audio consultation and the second one is the video consultation. you can approach us through either one of it. And also, after the consultation has been done, and if you're having any sort of investigations already done, you can share it with us. After the case taking and the doctor consultation, the medicines will be delivered to you, especially to the online clients. Home delivery will be done. If you're staying in India, it will take 3 to 4 business days for our medicines to reach your doorstep. If you're staying in USA, it can take 3 to 5 business days. Across the globe, it can take 4 to 8 business days. If you want to contact us, you can contact us to the given number here, either through WhatsApp, either through call, or either through message. Okay. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you are experiencing any sort of fibroid issues, infertility, or female reproductive diseases like endometriosis, adenomyosis, chocolate cyst, or hemorrhagic cyst, PCOD, PCOS, dysmenorrhea, which is painful periods, if you're looking for cure, Fidicus Homeopathy is the answer. Why is it that you should choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. First, the reason for doing this video is itself because of the high and good amount of success rates that we are having in this female reproductive organ diseases. Second is the transparent treatment, where there is no gray area between the patient and the doctor. We will be discussing you in detail about your prognosis. And the third thing is the personal care. The personal care here at Fidicus is really top notch. The reason for this video is because of the personal care. That is because in persons or the online clients have asked us so much of questions that we wanted to do a video in order to convey it and also in order to educate other people. So the personal care, we will be discussing in detail all of your myths. We will be busting it and we will be educating you. So if you want to choose cure, if you want to have an answer for all of your diseases, Fidicus Homeopathy is the answer. So choose Fidicus Homeopathy if you want to choose cure. Thank you.